Today, we are diving deep into a condition that really turns everything we think we know about pain on its head. It's called Complex Regional Pain Syndrome, or CRPS, and it's one of the most baffling disorders out there, where something as simple as a minor injury can set off this cascade of totally disproportionate body-wide symptoms. Let's get into it. So, on paper, CRPS is a chronic pain condition. But what does that actually mean? Well, imagine you sprain your wrist. You expect it to hurt, then get better, right? But with CRPS, instead of healing, the pain just explodes. It becomes this excruciating burning sensation that is completely, wildly out of proportion to that first sprain. And then, weirder still, you start to see the skin on that arm change color or feel ice cold when the other is warm. That's the bizarre and confusing place where CRPS begins. But here's the big question. The one that changes everything. What if that intense, localized pain isn't the whole story? What if it's just the tip of the iceberg, the most obvious signal of a much, much deeper problem happening all over the body? Answering that is really the key to understanding what it's like to live with this.
And that really brings us to the central puzzle of CRPS. For patients and for doctors, this whole journey starts with one limb and a whole lot of confusion.
Because while the fire of CRPS might get lit in a single arm or leg, it almost never stays put. That localized pain, it's really the first warning light on the dashboard signaling a massive system-wide malfunction.
And that system-wide malfunction, it often sets off a whole cascade of other health problems, what doctors call comorbidities. And when you look at the numbers, you start to see just how connected everything really is. It's staggering.
Get this, a massive 70 to 90% of people with CRPS also have serious sleep disorders. And this isn't just, the pain keeps me awake. It's a two-way street. The pain wrecks your sleep, and then the lack of good restorative sleep actually makes you more sensitive to pain. It turns the volume up on the CRPS. And the hit isn't just physical. Somewhere between 50 and 70% also struggle with anxiety. And again, this is so much more than just a normal reaction to being in pain all the time. The very same deep mechanisms that cause the physical pain of CRPS can also mess with your brain's chemistry, directly sparking anxiety. It creates this vicious cycle of mental and physical distress. Now, here's maybe the biggest clue of all. A huge portion, we're talking 40 to 70%, of CRPS patients also get diagnosed with fibromyalgia. Fibromyalgia is famous for its widespread all-over pain. So when you see an overlap this big, you just know we're not dealing with a coincidence. Something bigger is at play. Okay, this table just lays it all out. You see these huge overlaps not just with fibromyalgia, but with migraines, with irritable bowel syndrome, depression, Raynaud's. But now look at that column on the right. Key shared mechanisms. See those words popping up again and again? Central sensitization, autonomic dysfunction. These aren't a random collection of misfortunes. They are all different symptoms of the same core problem. So what is this connection? How in the world can one single condition link your nerves, your gut, your blood flow, and your mood all together? Well, it turns out there's a really good explanation.
And it's this. This is the whole point. This pattern of all these overlapping illnesses, it isn't just bad luck. It's evidence. It's the proof that CRPS was never really a disease of one limb. It's a disease of the entire nervous system.
The best way to think about it is like a major glitch in your body's operating system. There are three main things that go wrong. First, you've got central sensitization. This is where your nervous system basically gets stuck on high alert. The volume knob for pain gets cranked to 11 and then breaks. Suddenly, a light breeze on your skin can feel like fire. Second, there's autonomic dysfunction. This is the system that controls all the automatic stuff. Your heart rate, body temperature, digestion, it just goes haywire. That explains the weird skin color changes, the swelling, and even the link to things like IBS. And third, you have neurogenic inflammation, where your nerves themselves start freaking out and releasing inflammatory chemicals, creating real inflammation without any new injury. So you can imagine, right? A glitch that affects the body's entire operating system. It creates some absolutely enormous challenges, not just for the person living with it, but for the doctors who are trying to figure out how to help. For example, just telling CRPS and fibromyalgia apart can be a nightmare. On the one hand, CRPS usually kicks off after an injury, it's in one limb, and it has that classic burning pain with all those visible changes in skin color and temperature. Fibromyalgia, on the other hand, tends to be a more gradual, widespread, achy kind of pain. But what happens when a patient has both, which we know is super common? Untangling those symptoms to get the right diagnosis becomes incredibly tricky.
And that diagnostic confusion often leads to this awful, vicious cycle of treatment. You have multiple conditions, so you get multiple medications. That's called polypharmacy. That jacks up the risk of side effects and bad drug interactions. And the whole time, the sheer exhaustion of juggling all these appointments, all these pills, all these symptoms, it becomes completely overwhelming. And it can all lead to this downward spiral where health and quality of life just keep getting worse.
So, if treating each problem one by one is a recipe for disaster, what's the answer? Well, it's all about a big shift in perspective. It's about a smarter, more holistic approach.
Instead of one doctor trying to do everything, the gold standard of care is to build a team. You have a pain specialist who's the expert on the complex meds and interventions. You have physical and occupational therapists who focus on getting function back and gently retraining the nervous system. You have a psychologist who provides critical tools for coping with the massive mental health burden. And then you bring in other specialists as needed, like a neurologist for migraines or a gastroenterologist for the IBS.
And here's why this approach is such a game changer. It's all about synergy. When you combine these treatments, the result isn't just 1 + 1 = 2. It's more like 1 + 1 = 5, because when a psychologist helps lower a patient's anxiety, they're suddenly more able to participate in physical therapy. And when the pain specialist gets the pain under control, sleep improves, which then makes the patient less sensitive to pain. Every single piece of the puzzle helps all the other pieces fit better. So the goal completely shifts. You stop playing whack-a-mole with individual symptoms and you start treating what's actually broken, the entire interconnected, dysregulated system. You're not just treating CRPS plus fibromyalgia plus IBS anymore. You're treating one person whose system is expressing itself in all of these different ways.
And this really leaves us with a final, crucial question that goes way beyond CRPS. In our modern medical world, which is so focused on specialization, how do we make sure we're always remembering to shift our focus from a list of diseases on a chart to the whole, complex, interconnected person sitting right in front of us? That's the challenge, but it's also the goal for a much smarter and more compassionate future in medicine. Thanks for listening.